All right, my name is Peter Lemmy. I am the learning coordinator for Bushra Ibnauf Center for Learning, Juba, South Sudan, for SAMA, Sudanese American Medical Association. Today, I'm going to share with you some of the work that SAMA has been doing in South Sudan. But before that, I will give you a general overview of what is SAMA, and then I will give you a slide presentation about Project ECHO, the model that we are using in Project ECHO, and then some of Project ECHO Hub in Khartoum, and Bushra, Dr. Bushra Ibnauf Center for Learning in Port Sudan, and about SAMA Africa. And of course, the last issue that we'll be discussing today is about infectious disease ECHO. Let me begin by introducing SAMA, the Sudanese American Medical Association. SAMA is a non-profit organization with offices in the United States. It was established and has an established office in the United States since 2008. In Sudan, the office was established in 2017. And the office is still running and implementing some of the programs. So before the war, SAMA has been implementing some educational programs and also organizing some surgical missions for undeserved and underprivileged locations in Sudan, but also providing medical supplies in some selected areas in Sudan. And after the April war, 15th of April 2023 war, SAMA began organizing some humanitarian relief and the educational capacity building programs for medical doctors is still also continuing in Sudan. The project, the capacity building program is done through an ECHO model. The ECHO model is about telementoring, that is mentoring from far, where we have subject matter experts in the United States presenting some cases or giving capacity building programs from US, and then we have some partners and participants attending the programs from different parts of the world. So as you can see in this PowerPoint, we have subject matter expert in the US giving his presentation, and you have people in Dongola in Sudan, and others in Mogadishu in Somalia, and then you have case presenter of SAMA hub in Khartoum in Sudan, but then also the hub in the University of Khartoum in Sudan, also attending simultaneously the capacity building courses that SAMA is organizing. So the Project ECHO that facilitates the learning that SAMA organizes amplifies the use of technologies. It makes use of the available resources, the technological resources, that is the e-learning programs, and also making use of the best practices to reduce disparities, because the subject matter experts are people who are specialized in their areas of expertise, and so they draw wisdom from their expertise and best practices, and also they share this expertise with the learners from different parts of the world. In addition to amplification of the technology, of the use of the technology and best practices, some also present case-based learning to the learners, and this is to make them to master complex issues, medical issues. And of course, this model make use of web-based database to monitor outcomes of these capacity building programs. So the Project ECHO model is summarized by the alphabets. A stands for amplification, and B stands for best practices, and C stands for case-based learning, and then D stands for web-based database to monitor the outcomes. So what did Summer do before the war? Before the war of 2022, Summer has been in front line to build the capacities of the medical doctors. This is from 2021 to the first quarter of 2022. And then from 2022, the second quarter of 2022, Summer was presenting Dialysis Echo. This is a project, or this is a program that focuses on dialysis. And then from the third quarter of 2022, Summer has been doing the capacity building in the University of Khartoum, giving surgical programs online to the learners in University of Khartoum and other universities in Sudan. In 2023, there are a number of issues that Summer focuses on, of course. That is the medical supplies that Summer offers, but also the humanitarian support that Summer is offering. You can see in this picture, we have the late Prof. Bushra Ibnauf in the right side, and then on the left side, we have the learning center of Bushra, Dr. Bushra Ibnauf in Port Sudan. As you can see, the sitting arrangement and how it is designed. Right from 2023, Summer is offering trauma echo programs, but also dental school echo programs, in addition, of course, to the humanitarian and the medical supply programs that Summer is doing. So the learning hubs that Summer establishes in Port Sudan, in South Sudan now, in Juba, plus in other parts, have very big turn-up of people who have been attending these programs. We have around 3,771 learners participating in these ECHO programs, and then around 150 subject matter experts, plus around 107 case presenters and 73 echo sessions. The maps that you can see here present the locations where people participate in the echo programs. Currently, Summer has rolled out infectious disease echo program. This program connects health professionals in South Sudan, in Juba, South Sudan, together with their counterpart in Sub-Saharan Africa, and of course in Port Sudan, because of the situation of the war, with the global experts in HIV, TB, and hepatitis B. This ECHO program also will be the first activity, will be launched for the first time in Juba, South Sudan. So we'll have, in Sudan, we'll have Dr. Bushra Ibnauf Learning Center in Port Sudan, but also in Juba, South Sudan. The purpose of this program is to improve the capacity of healthcare providers to treat HIV, TB, and hepatitis B in a better way. It is an initiative of Sudanese American Medical Association, the SAMA, to spread knowledge without barriers in Sub-Saharan Africa. As I said earlier, the subject matter experts, these are Sudanese experts who are residing in the US and who wants to share their knowledge and their expertise with health care workers across the globe. So we are in the process of establishing the second Bushra Ibnauf Center for South Sudan in Juba. And we are glad that we'll be providing this capacity building to medical and healthcare providers in South Sudan. In Juba, the director of SAMA in South Sudan is Professor Ihab Abdulrahman. Dr. Ihab is professor of medicine from the University of Khartoum. He was previously the director of Soba University Hospital, and he is currently the Dean of Medicine in South Sudan, in South University of Medicine, Science and Technology in Juba. He is one of the co-founders of Bushra centers, and also one of the pioneers of SAMA. And also, we are partnering with the Ministry of Health in South Sudan. Dr. Malik is our focal person. And of course, we have Dr. Luay and Dr. Hamad Abdul Hadi. These are some of the experts who will be supporting SAMA's activity in South Sudan. So for the sessions that the learning center, Bushra Ibnauf Center in Juba, as I said earlier, there are 3 infectious diseases that we are focusing on this time: HIV, hepatitis B, and then TB. So for the HIV, we'll have a total of 7 sessions. These 7 sessions will be under the HIV program. The 7 sessions, as you can see in the screen. And then we have a link. The link, a WhatsApp link. I encourage all the participants to go into the link, to click in it, and then you can register for the upcoming capacity building courses on infectious diseases that SAMA is providing. So I'm going to stop here. Thank you so much for your participation.